the Institute for the Study of Peak States presents the second International Psycho-Immunology and Psychobiology Research Symposium. Treating Pain Using Psychobiology, presented by Dr. Kirsten Lykkegaard.
So our next speaker is Dr. Kirsten Lykkegaard. She's a doctor of veterinary medicine and also holds a PhD in pharmacology. For over 19 years, she has contributed to fundamental biomedical research within the somatic pain, obesity, and type 2 diabetes areas. As co-director of research at the Institute, Kirsten's current focus is on developing effective psycho-immunology treatments for specific viral and bacterial diseases. She is also investigating the causes of diseases of unknown etiology, such as autism.
Okay, so I'm going to talk to you about treating pain using psychobiology. And I'm going to start out with saying that this is material that I'm going to go through is not a substitute for a medical attention. I am a veterinarian, not a physician. That means I'm not licensed to diagnose medical conditions in people, but if you're a dog, no problem. Suggestions in this talk are not intended as a substitute for consultation with your healthcare provider, because there can be pain conditions that really needs that attention to not lead into disability or death, for example, appendicitis or fractured bones. So be aware of that. If you have pain that resembles some of the cases that I will show in this talk, there is no guarantee that you can get the same results. And the reason for that is that your pain may or may not be the same, and there may be additional things that needs to be addressed in your case. So a bit more background. So I'm a vet. During my veterinarian training and first years in the veterinary field, I was very driven by the problem of pain in animals and the problem that veterinarians themselves inflict as we do surgery. And so I went back and did a PhD in pharmacology with focus on surgery-induced pain. And during those years, I also taught and did some courses in managing pains in animals. There is one important point here about this talk, and it's actually evolving around the next sentences. If conventional medicine was able to treat all pain conditions successfully, this talk would be irrelevant. So, and I also want to state that ISPS has not invested time on research in pain as a separate field, that everything we've done and are doing is because that clients have asked us, and that some of the implications of what we can do has come out of research that we were doing on other things. So, and the last bit is that I have had some help from my colleagues collecting data on cases, and I will use that for showing how we're doing this work. So back in my days at the university, I was, and doing my PhD, I attended a lot of conferences on pain, and it was exciting. I mean, there was just so much going on, new knowledge in the neurophysiology about transmission of pain and the sensitization, and everyone was pretty sure and hopeful that we would soon get new drugs to treat these conditions, but that has not been the case, unfortunately, as currently we're still using some of the old drugs, and many of them are with limited efficacy, and they're not treating the root cause. But there are actually, in areas of research, some more recognition about the emotional and cognitive impact that can have on the perception of pain, as well as the plasticity in the central nervous system that can happen. And there are concepts like reconsolidation of memory that is also occurring that seems to be addressing also this way to work around or make the nervous system plasticity unlock. And it has some similarities to the trauma healing that I will talk about later. So that's exciting. I will spend a few slides here, actually, and quite a number, just to talk about the medical model, because that's basically almost empirically what we all understand about pain. And with that, I will give some opinion about where it's really good and also how it sometimes can limit the way we could do pain treatments going forward. So start with the International Association for the Study of Pain. They have defined pain as an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. There are other implications that are kind of coherent in this thinking, and that is that pain is a physiological consequence of tissue injury and serves as a vital protective function. And if pain persists beyond the absence of pain, of tissue damage, it can become a disease. So this aspect of that, even though, as you can see, that there's the use of the word resembling and potential here, there's still this assumption unconsciously that generally, it's just in our language almost, that for most people and in conventional medicine, that there's this assumption that pain exists. When it exists, that there must be some damage or some sort of pathology somewhere. And because of that, there's a lot of effort into finding it, and x-rays being taken and findings that might or might not be related. A lot of times, of course, it is, but a lot of surgeries and unnecessary testing and overuse of drugs is the consequence here. So that was the definition. Now let's take a look at how it works in the body. How do we know that we have pain? If we think of an injury moment, like in the drawing here from Descartes from 1700 and 30s or 60s actually, the pain will come in two waves because there are two types of pain fibers. One that transmit fast, that's the A delta fiber, and it causes a sharp, intense shooting pain. And if you imagine this young man here with the foot in the fire, that's what makes him withdraw his foot. And then the second wave will come and it will cause this dull, poorly localized burning pain that we all know as that prolonged feeling of pain. And the pain is perceived by those signals from those fibers arriving at the brain. And in the brain, we can modulate it by mood or prior experience, anticipation. And this is ongoing, the perception and modulation as nervous input goes on, but it can also be prolonged if the injury and inflammation is there persistently, or if the nervous system gets sensitized, which I'll come back to. So just a little bit about how can we categorize and treat pain in the medical field. So the quality of pain can be described, and it's actually very diagnostic in lots of ways. So your doctor will ask you this. We also use it in our work, and it's because it leads to a clue on some of the underlying issue going on. As you can see, some of the descriptions are really physical, and then here at the bottom here, there are some that are actually pretty emotional, again, showing that it's a physical and emotional experience. We can also look at or categorize pain into acute versus chronic, and the acute happens quickly, goes away pretty fast, but it can linger for a few months, but it's related to these things that we all know about: surgery, broken bones, dental work. If it persists longer, for 6 months or longer, then we call it chronic, and it can also stay even when things have healed up afterwards. But some of the pains that are here is headache, arthritis, cancer, nerve pain, back pain, fibromyalgia. And from this aching in the body, there's also other things that can happen physically. The muscle tense up, and energy level, change of appetite. Some people become depressed, angry, or anxious. And then lastly, there is the medical or biological way of categorizing, where we actually look at what tissues are involved. So in this case, nociceptive or somatic is everything in the body except the nervous system. And It's usually treated by support to heal and pain medication. Then we have neuropathic pain, damage to nerval tissue. It's treated by treating the underlying. So if you have diabetes or if you have B12 vitamin lack, then you treat that. But then otherwise you use, again, drugs, but they're different than normal drugs for this particular. Then there's pain from if your spinal nerves have been compressed or stenosis. And for that, usually surgeries or alleviation of the compression with surgery or nerve blockages, pain medication as well. Then we have inflammatory pain, which is seen in autoimmune disease like rheumatoid arthritis. And again here, pain medication, diet, and some modulating, so anti-inflammatory and disease modulating, again, medication. Functional and somatic diseases like fibromyalgia, no obvious physical damage in the body, but so it's treated multidisciplinary. So there's some drugs involved, but also a lot of physical therapy or mild exercise. And then the last thing I want to say here is the sensitization. And that's actually a thing. It's a phenomenon. It can happen in pretty much all of these pain conditions. And it is a condition where your pain, the reception of pain is greater, and also non-painful stimuli can cause pain. And treatment here is again multidisciplinary usually, but some pain treatment too, of the same as neuropathic usually. So this sensitization that I just touched base on is a huge problem. So I just will show you just a brief how that actually works. So if you imagine that this is a graph that we'll put a graph in a second. This is the experience of pain. So no pain down here and maximum pain up here. Then this is a stimulus that increases. So imagine, and they actually do this in the research, they have a thing where you can, for example, put your thumb in and it's squeezed slowly more and more and more and more until here you'll start feeling pain. And if you take 100 people and you do that by increasing that pressure, this is sort of the curve you get of the experience of the pain. So, but if you take a hammer and you do the same to your thumb, then it will start swelling and thumbing and doing things. And with that, when you have damage, this whole curve moves to the left. That means that when you press on your thumb, that usually just causes a little bit of pain, it will cause a lot of pain. And as you know, with sunburns, if you wear a t-shirt over your sunburned area, even touch can feel painful. And that's this phenomenon. And usually this peripheral sensitization is what we call it. That is due to inflammatory molecules acting on the nerve fibers. That goes away when things heal. What can happen is that you have a thing called wind up and central sensitization, is that the nervous system of the spinal cord and the brain can act in ways where it undergoes some plastic changes, and it gets stuck in this state of heightening reactivity, which includes, just like I said before, this increased perception of pain, and non-painful stimuli now feels painful. There can be spontaneous firing in the nerves, and the area where you perceive the pain can increase. And less commonly, there can actually be heightening of sensations like Joy talked about earlier, sorry. It's sort of an increased sensitivity to other senses. And as you can see here at the bottom, it is actually across a lot of chronic pain conditions that this can happen. And the thing is that this state is usually described as the reason it occurs is because of prolonged pain is the hypothesis on why it occurs. That it allows the system to build this thing up, this situation up. So I'm gonna go further on and talk about why do medical treatments for chronic pain not work very well. there's actually an area where medical treatment works really well. And as I'll show you here, I just try to put in just different kinds of pain. And you see this area over here, it actually works really great. And it's, if you look at all the different conditions here, broken bones, tumors, appendicitis, heart attack, they're all due to something going wrong. And because the treatment is actually fixing or eliminating what goes wrong, the pain goes away pretty good. And I mean, I'm a big favor of these treatments here. And I mean, sure, you can do other things as well, but please take me to the hospitals if I have appendicitis here. Then we have a big group of mixed results in the medical treatments, and it really depends on the condition. You can really be lucky, but it's actually a lot of, it's surgery and drugs mostly, or I mean, supporting the systems, but not an actual cure. So you might get lucky and get good results, but, and for example, some of the things treating with pain medication can be okay, whereas for some things, but opioids might not be okay for the long run. And then there's this whole group over here, which is ineffective for psychosomatic diseases and where there is no physical damage. So, as I said, it's good for the where we able to remove the root cause of the problem and thereby eliminating the pain. But with chronic pain, it's just not, often not adequate. And so why is that? And why does this central sensitization occur? And that interpretation of why it is caused, is it really caused by that prolonged pain state? And here are just some thoughts about it. What if it is caused by that? When you just look at it, just like Joy also mentioned, it looks a lot like heightened sensitivity, which we see in PTSD in the nervous system, which actually might lead to why there's such a good treatment for, or why it responds so well to trauma therapy. And the other way around it could also be that there is just another co-founding variable that we have not found, or that medicine has not found yet. Because if we do and you treat it, it should actually work. So I'm going to now go into psychobiology, so our model of pain and how we treat it. Before I do that, I just want to say that we're a big fan of medicine and that we're not rejecting any of the science and data that is on this. But what we do is expand and not supplement, but expand and fill in some of the holes where there are no good treatments so far. So if you look at our model, we model that consciousness reside in a totipotent stem cell called the primary cell. And what happens is that we superimpose this cell and its well-being on the on our physical body in the present. And therefore, pain can come from either the physical injury that you have on your body. You can get sprayed ankle, fractured bone, or pinched nerve. And in most cases, a person will actually experience an emotional trauma around this injury or around the subsequent pain. And this is why, one of the reasons why trauma therapy actually helps on pain. Then there is also injuries and pathogens that I'll talk about that are in the subcellular level and can cause pain from there. And then there can be the combination of the two, often we see both. So the implication for treatment is, as I just mentioned, that trauma therapy actually works pretty well. And it's a very simple way. And we have no clinical trials to support us in this statement, but we do know from a fact that the creator of EFT, that tapping is quite effective. It's sort of in the order of 70 to 80% for elimination and up to 95% for actually reducing pain. Again, the patients that might seek this help might be biased. It's not a full population maybe of who has pain. So that's one of the things that can make this data maybe a little screwed, we don't know. So we have a clinic that works with some ISPS certified therapists, where what they report is that they have up to around 70% of cases they can actually heal with simple trauma. The interesting aspect of this is that when we talk about what kinds of pain, it just seems to be across all the pains that I listed up above in the talk on the different classification of medical pains. So, and the other thing, when you say 70% on this one works on tapping, we still have about 30% that don't respond. And for this, the subcellular causes is very crucial for success in this group of clients. And so when tapping doesn't really work, it can be due to these structural injuries. And they're only indirectly related to trauma, or it can be even something that we call time looping. It's something that causes trauma to reset itself. Or it can be that the feeling of pain has been coupled to survival, so that it creates this feeling inside the person unconsciously that they need the pain. The body just thinks that it will simply die if it doesn't have the pain. So you need to address these and this to actually get better results on the tapping. Yep. So let's take a look at how well it actually works in the work that we do. So just notice that compared to the slide that I had for medical treatments, that I just totally skipped the one with the acute disease, or the acute pain that can be treated very well by medical. What is striking about our work is that we actually are very good in doing something that the medical is not, and that is, if you look at this category here, it's sensations of burning, stabbing, pressuring, and cutting pains that have no apparent biological origin. So you can say psychosomatic in some senses. We also have, as Grant touched on, and we will talk some more about tomorrow, some potential, great potential for eliminating pathogens that cause pain. And I think Shane has a talk on Lyme tomorrow. And we also have some preliminary results on these conditions. Then we have this group where I say good results, or could be improved. They are trauma healing and things on the subcellular level works pretty well. And then we have a group over here, and it's not, I haven't put in all the things that we haven't researched, but there's a certain amount of things that we really haven't done yet. So let's look at how do we actually treat it. So again, simple, start simple. Tapping is gives you about 70% of the cases. And when we say elimination of pain, we actually mean that it happens in the session that you do with your client. So it's pretty powerful. We address the client's issue, like I believe Nikolai said in the previous talk, about having this pain in their body. And this works because most people separate themselves from the pain. And after you have pain for a while, that can, you might not even notice that that's what's going on. But this is often what causes the pain to linger in the body. So tapping is good. And I have a few cases here to show you that this is just acute pain here. And so my first bullet here says, be sure that this person is not needing medical help right away, because acute pain could be medical. But here are some cases. There was a person with stomach ache after a prolonged period of work, and just tapping on the emotion that she found inside the area of that pain released the pain, and it went away fully. And another client who had a lump that had appeared 2 days before the session, and it was very painful. And just doing what she felt about this pain eliminated the pain, and also the lump actually went away very soon after. So, and then we have chronic pain. And here I'm just going to talk again about the simple tapping. It's often due to trauma, PTSD. and it can have some subcellular causes as well. Simple tapping works for the most part, and that can be also in biographical and generational traumas. So here's a person with cluster headache for years. Don't know why that was, and it happened several times per week. And with this simple tapping on the biographical and generational traumas, the pain or the headaches, the frequency of the headaches reduced to once every 2 weeks. And another case where chronic back pain for 10 years after a chipped vertebra and a emotional crisis. The person was healing a biographical and generational traumas, and I mean the pain went away. The subjective unit of the stress scale was at a 5 to 8, and it went to 0. So then we look at chronic pain where it's not just simple tapping, but also other things. So you can do simple tapping, but you need to address some other issues for this one to go away. This one is interesting. This was neck pain for 4 months. This person woke up in the morning one day and was just having pain, and went through an MRI scan, and it showed C5, C6 stenosis, and the physiotherapist said that you need to just get used to this pain or have surgery. And then we did some healing here. There was a hole. I'll explain about the hole in a second. Soul loss and one biographical trauma, and the pain just went away fully and has been stable. So, and here's a chronic back pain for more than 20 years. And that was a crown brain structure. So before I tell you about that, I'll just show you that we're also very good at healing pains around menstrual pain. And it's usually due to generational traumas. There can be lots. So the tricky part here, I mean, the technique works. The tricky part can be to find all of the generations. So here are some examples of a person who had lots of different symptoms, healed generational traumas, and the pain vanished fully. And another one who just healed one generational and went from a really high score on the SUT scale to 6 and was pretty happy with it. But she's not, I don't think she's fully done yet, this client, and there's potential to get it better even. So let's take a look at the subcellular cases for treatment of pain. So I just mentioned that holes can cause contraction, and they can actually lead to pain in that condition, in that location. We have something we call soul loss, which doesn't, if you heal it, it doesn't get rid of the pain, but it's very distracting. It sometimes resides in the same areas as the pain. Crown brain structures are a structure inside the cytoplasm, inside the primary cell that limits movement and actually hurts when you start moving. So this is what hole can look like to the person. They can actually, the client can usually see this in themselves. It's an overlay from the primary cell. It looks dark and it feels like horrible, empty, deficient, black, bottomless hole in the body. And a person will do anything to feel that emptiness in there. And that's why it causes contraction. And you see that a lot in pains around the body, soft parts. Then we have the crown brain structures. This is something that happens in the primary cell where the cytoskeleton, for some reason in a traumatic moment, connects parts of the cell that should not be connected. It kind of locks your body in a place so that you can't move, and when you move it, it hurts. So the treatment is to find that trauma and heal that. Then we have all the subcellular causes of pain due to pathogens, and I've just listed the symptoms that they can create. So here's some of the symptoms that you saw under the psychosomatic in the table. It's like pressure pain, squeezing and compression, burning, acid-like ripping, sharp nail. So these are all due to some sort of pathogen in the primary cell. So I have an example of this sharp nail-like pain on this one. this is it causes a stabbing feeling in the person, and it's due to a fungal filament that penetrates a place in the primary cell, and that primary cell corresponds to where on the body you have the pain. You can treat it one by one. If you just have one, you can release that with a certain process, or you can get immune to that fungal, which we do with our silent mind process. So here's a case of a person with neuropathic pain, stabbing in several large scars after surgery. And the client was able to recognize that there was this very sharp, like nail-like in one of her scars. And the silent mind process was used, and all of her scars stopped hurting after this one. That's quite striking. I've never heard of anyone having that happen with so many, but one or two is very common actually. So we have other types of pain can be from what we call a copy. And those are tricky because you really feel it in your body, but they're actually in a sort of, it feels like almost a balloon on your body when you really pay attention to it. If you're not aware of it, you won't probably find it like that. But when you do, and you put your attention in there, you can actually feel that it feels like someone else, someone that you know maybe even. And it's because you copied in a traumatic moment. So I am running over time here, I can see. So let me just jump over. This one is also about pressure, and it's due to fungal structure again. It presses, so there's again a trauma healing technique for removing that. Shane, I'm gonna skip this one because I know you're gonna talk about headaches tomorrow, but there are lots of causes for headache, and we have treatments for some of it, but we don't know everything about headaches, I'd like to say. And we also have a psycho-immunology treatment for pain. Those are the pathogens that Grant was talking about earlier. And there's one for Lyme disease. And again, I know, Shane, you're going to have a talk tomorrow, so I think I'll leave this one to you as well. But it's quite amazing. This is actually where people think they have joint pain, and it turns out that they actually have a spirochete with all the symptoms from that in their body. At least doing the process has helped a lot of people here. So I'm going to just wrap up this talk and by saying that as you've seen, we have quite a number of books out as we try to give this information about all the work. And there are EFT manuals for free for download, and you can actually tap on the emotion that you feel about your pain to reduce or eliminate that pain. But if it doesn't work for you, it's actually not, you can say it's not, it doesn't, how to say this, just because it doesn't work for you, it doesn't mean that it doesn't work. It can be for other reasons, and here are some of them. So not healing the correct trauma or healing all relevant traumas is one. Trauma having time loops, the one that puts the trauma back, so healing is not stable. The client is not able to face the trauma. The therapist is not skilled enough. Techniques used are not good enough. Pain caused by unknown pathogens or mechanism that we don't know anything about, so we don't know what to do. And that other thing that I actually skipped a slide earlier, saying something about tapping on and fixing injury. If there's inflammation, the inflammation doesn't go away immediately. So there can be lingering pain, so you have no clue if what you did actually worked or not. So those are just some of the challenges. But if I should sum up what I find that is really interesting from putting together the medical treatments with what we do, is that for both models, you can say, pain can actually be successfully eliminated when the root cause is treated. So if you look at the medical interventions for pain, it works great for many acute pain conditions. Treatment of chronic pain conditions are a lot of times only symptom reduction. Sometimes it's acceptable, other times not. Ineffective in treating psychosomatic related pain conditions, and it doesn't address any PTSD like the central sensitization from a trauma perspective. And if you take a look at our work, if we think about the trauma, simple trauma therapy actually works for the majority of cases. Psychobiology treatments add to the success rate. And we we can work on chronic physical as well as psychosomatic diseases. Not that we can do everything, but we have a pretty high success rate on it. And we have great promise for pathogen treatment that can cause pain. I think the strength within each of those should be used a lot more to complement each other. So I'd like to say that the optimum outcome for a client would be if both modalities are integrated. And with that, I'd just like to thank my colleagues at the Institute, and thanks for this talk, especially thanks to Grant McFedris, Nikolai Lund-Hessing, Astrid Polini, Selini Guern, Mary Pellisier, Shane Mackenzie, Lars Meigen, Gitan Klein, Julian Drew, and Gita Ibrahim. And also thanks to all the clients and volunteers working with us over all the years. Thank you. And I don't know if I have time for questions. That I think was Shane. I'll let that be up to you.
Yeah, the only question here really is people really appreciated and wanted to know how they can either get in contact with you. You've got your email address up there, which is great. And is there a website as well that they could go to as far as learning more about pain?
Well, as I think I had on slide 2, we haven't really put time and effort into this. We do it because it's kind of a side effect of the work here, but I think it would be great to maybe have more attention on it in the future. So, but I would be happy to have correspondence with people who are interested. So thank you.
So that's Kirsten at peakstates.com, Kirsten. Okay, excellent. Thank you very much.
Thank you for watching. For more information, visit peakstates.com.